Checkpoint is presented by GM Pharma, the first international multinational pharmaceutical company in Georgia. GM Pharma, to serve those who need it most.
The World Bank is helping governments develop long-term solutions that will build more resilient, inclusive economies in the post-pandemic era. Examples of such work include Ukraine, where the World Bank is strengthening the country's health response to COVID-19, including modernizing emergency departments and stroke units in 40 hospitals and training thousands of Ukrainian doctors. In Turkey, the World Bank is supporting the development of TV and digital content for blended teaching and learning when schools reopen. In Georgia, before the official launch of the Human Capital Program just this week, the World Bank had already been supporting two projects critical for human capital development. The Innovation, Inclusion and Quality project aimed at increasing access to preschool education, higher quality education and improved learning environments, and the Login Georgia project, which sets out to bring fast and affordable broadband internet connection to nearly 500,000 people living in rural and hard-to-reach areas, making available such services as e-learning and telemedicine, both of which have proven to be invaluable during the COVID-19 pandemic. For more analysis, we sat down with Ahmet Levent-Yener, Program Leader for Human Development, Europe and Central Asia at the World Bank. What is the main focus of this program? Why human development and why now? And why in Georgia? Too many whys.
Well, let me start one by one. Thank you, Elena, for giving us this opportunity to talk about this very important topic. But if you let me, I would like to start with what human capital is. Human capital is the education, skills, health that people accumulate throughout their lives. It is important for building strong societies, which will bring the nation to the next stages of its development agenda. We would like to focus on the human capital as the main driver of the nations and how it helps to build further on a nation's wealth. Traditionally, physical and natural resources are thought to be the main drivers of a nation's wealth. However, a recent World Bank study shows us that 64% of a nation's wealth is coming out of the human capital. In 2018, by relying on this, information, the World Bank has initiated this Human Capital Project, a global initiative, which helps the countries to strengthen their systems and to provide better services to people in building a stronger nation. The government of Georgia is one of the early adopters of this Human Capital Project and is a strong advocate of further human development in Georgia. We also see that the civil society, academy, and development partners is a part of this broader program. So that is why, as one of the members of the Development Society, we would like to help this huge effort of the government of Georgia deal with this endeavor.
In this specific point in time and situation, what would you identify as the main challenge towards this goal?
This is a continuous effort. And there are many challenges, but before coming to that challenges, we have to talk about the achievements of the last decades, like the universal coverage in health, like student-based, competency-based national curricula, and like the targeted social assistance. The problem is related with the reaching the full potential of the people. Let me tell you how we calculate this, how we calculate the full potential, human capital potential of one country. We use our Human Capital Index, which is developed under our Human Capital Project to measure a country's full human capital potential. And Georgia's human capital index score is 0.57. This means that a child born today will reach only 57% of productivity that he or she reaches adulthood and be a member of the workforce. We may talk about the challenges that keep Georgia's human capital index score down. There are two main causes for that. One is the harmonized test scores, and the second one is the adult survival rate. For the harmonized test scores, we rely on the international tests like PISA, TIMSS, and we use the 2018 scores for Georgia, where an average Georgian student gets 400 out of a score of 625. And for the adult survival rate, we talk about only 85% of an 15 years old will reach to age of 60. And this statistics shows us the health risks that a child born today will be facing throughout his or her life. In our recent human capital review, we present that around 6% of children today still face with the problem of stunting, which is a very big problem for further cognitive development.
We basically mentioned education and we also mentioned the health sector. What are some other sectors that are also involved, like directly or indirectly, in building this human capital, just to see the scope of this program?
Exactly. So a development of a country, of a nation, is not only built on the human development sectors that we call education, health and social protection, and employment and jobs, but the support of all the other sectors are important. There, we recommend the client countries, the countries that we work with, and to Georgia, to build efficient systems and build effective coordination between government agencies as well as the all players in the field providing services to the population. In that sense, benefiting from the new developments like digital economy will help the countries to further build on this collaborative approach.
I understand that this is a long process, a very tough reform to be taken, but what are some of the measurable outcomes that you would be looking at while evaluating whether human capital development project in Georgia is working or not?
Well, this is a very good question. If Georgia benefits from full potential of health and education, its long-term per capita gross domestic product will be 1.64 times higher than its current value. So the comparison is with Georgia's today and with the future based on the investments to be done to improve the quality of education services, health services, and the coverage of the social protection system, and providing better public employment services for the whole population, including the rural and mountainous areas.
Yeah, but your focus earlier on efficiency of spending, so that means that not only investments, but smart investments, right?
Exactly.
What would that mean in Georgia's context?
Two things. First, Georgia has to spend more for social sectors, for human development sectors. Second, as you rightly mentioned, Georgia has to spend more efficiently and more cleverly. How can it be done? In the new human capital program that we are supporting the Georgian government with the French Development Agency, AFD. We are proposing, we're coming up with some recommendations that we work together with the government counterparts to improve spending efficiency. One is a revised general education financing formula which considers the demographic changes. The second one is a health system focusing on the services at the secondary level, at the hospitals, bringing a system that will allow unity in the prices of the health services. With some complementary measures, the patients will have access to cheaper pharmaceuticals. And with a targeted social assistance system, the beneficiaries will achieve the support in the most efficient ways. These are the three main areas that I can share with you.
The financing pool is like really large. I mean, it's 400 million USD, right?
400 million plus 100 million coming from the AFD.
So that's true. Also, if you look at the mechanism, the financing mechanism, it has this focus on results.
Correct.
I mean, it is a result-oriented financing. What does that mean, and why that focus on results?
In addition to us and AFD, we invite all the development partners to join us to support this huge effort of the government of Georgia.
That's a very good call.
But just to give you, as we started with monetary terms, yes, this project we're talking about $500 million, and I will come to the why it is focused on the outcomes. But the project aims bringing efficiency into the system. The government of Georgia, in a period of 6 to 7 years ahead, will spend around $6 billion to for human development services. And the program aims bringing an efficiency around $1.2 to $1.7 million savings. So the idea is to use the national resources in the most efficient way. Why it focuses on the outcomes? This is a new tool, a product that we and most of the other development partners have. It helps the implementing agencies in the government or the government as a whole to focus on the outcomes rather than inputs, rather than procurements, rather than identifying, collecting the inputs to make a cake. So this is a way of encouraging the implementation. And when the achievement is observed, like a pharmaceutical reform completed, including reference pricing, the government will be provided the funds to implement further actions. So then the whole focus of the people, teams, consultants working for the project or the broader program will focus on the results rather than the inputs.
Which is a very smart way to motivate governments. So which reforms could be the key where World Bank sees that Georgia has the capacity to
has the capacity, and that is why we moved to a results-based operation because Georgia has the capacity to implement it. And thanks for the question regarding which reforms? I believe the reforms focusing on three things: spending efficiency, inclusion, and connectivity will be the key to achieve this broader objective. The new project includes specific outcomes focused under these three main focus. I can give you some examples, like, under efficiency, the new general education financing formula will help the schools to use their allocations in the most efficient way. The efficiency will be achieved in the health sector through implementation of a rigorous preventive care model, strengthening the primary health care in order to decrease the future costs of treatment. And in targeted social assistance, the improved formula will help the government to identify the exact poor and needies so that the funds will be used in the most efficient way. Inclusion. What can be done for the education sector is to make more children in the rural and mountainous areas have access to kindergartens, where they will have better education, better nutrition, and better environments. In the health sector, there will be also, inclusive actions which will help the people to deal with the high out-of-pocket payments. These efficiencies will improve the implementation and also expand the gains. And for connectivity, I can also give an example from the education sector. There will be school digital actions plans at the school levels, which will help the students to expand, to improve their digital skills, which will help them to become equip them with the skills that are needed for the future workforce.
These are very comprehensive, very big reforms. Do you see political will there? Because these won't always be easy political decisions there. Because if these systems need to improve efficiency, it means a lot of decisions that might involve, I don't know, like firing people, that might involve bringing like new skills to the table. Do you think the government is really ready for those tough decisions that might not be always
Let me start. This is a hard question, and I'll try to come up with a response. What we are trying to do, together with AFT and other development partners under this new human capital program, covers only a part of the development agenda, because the package is big and it has to continue. So we talked about the achievements of the last decades, and when this project is implemented, Georgia will not achieve full potential. It has to continue. So it's a mandate for all the governments, for this one and the next governments, to continue in this one. The outcomes included in the program and other recommendations we shared with the government and all the society, all the development partners in our human capital review, provides a vision that needs to be continued. Will it be hard for the government? Yes, because at the end of the day, it's a trade-off. It's an allocation between social sectors, real sectors, and the governments may come up with difficult decisions at times. But investing in human capital will pay off in the future, and it will be beneficial for the Georgians in the coming years.
Exactly. What I know for sure is that we need these reforms. Thank you so much.
Thank you very
Thank
much
you.
giving us this opportunity.
The Checkpoint is presented by GM Pharma, the first international multinational pharmaceutical company in Georgia. GM Pharma, to serve those who need it most.